Welcome to The Art of Medicine, the program that explores the arts, business, and clinical aspects of the practice of medicine. I'm your host, Dr. Andrew Wilner. Today, I have the pleasure of speaking with Dr. Yoshihiro Katsuura. Yoshi is an orthopedic spine surgeon in San Francisco. He came to my attention because of his new book, written for patients, the Spine Encyclopedia. Not only did he write it, he illustrated it, and the cover is particularly cool. Today, we're going to talk about how Yoshi balances his passions for art, music, and writing with a busy medical practice. But before we get started, I'd like to thank our sponsor, locumstory.com. Maybe you're curious about locums and how it might fit into your career story. But do you know all the different reasons physicians choose locums and how it works for them? At locumstory.com, you can hear firsthand stories as diverse as physicians themselves. There's not one solution for everyone. The variety of opportunities might surprise you. Locum Story is an unbiased educational resource. It has tools that let you explore trends in your specialty and compare different locums agencies. There's even a simple quiz to see if locums is right for you. Do your own research at locumstory.com. It's easy. And now, without further ado, let's talk with my special guest, Yoshi. Yoshi, welcome to the program.
Thank you so much. It's a pleasure to be here.
Yeah, thanks for joining me. I saw your book and there's this, it's the Spine Encyclopedia, right? And it's for patients. So they can learn about their neck pain, their back pain, and potentially how to fix it or avoid it, all those things.
Well, the book is heavy enough to be an encyclopedia, so I called it an encyclopedia. And yes, it's primarily for patients. It's supposed to be a guide through an otherwise complicated and potentially scary, if not terrifying, world of spine surgery. But also it's for other physicians who may help and serve patients with back pain and neck problems.
So when you lift the book, you need to bend your knees, right?
It can
So
be
that you don't
used
they
as an
don't hurt you,
exercise tool,
don't
correct?
hurt your back. All right. So, all right, let's go back before the book. How did you get there? You went to medical school, you did a 7-year residency or something to become an orthopedic surgeon.
Yeah, so I went to medical school actually in Dublin, Ireland at the Royal College of Surgeons. And then I was lucky enough to do my residency at the University of Tennessee in Chattanooga, which was a phenomenal training program for me and exposed me to all of the problems and pathologies in the musculoskeletal system, as well as a heavy dose in spine surgery. And then I went off to New York, where I completed my fellowship in spine surgery at the Hospital for Special Surgery and at Weill Cornell Medical College. I spent a year there on faculty, but being from California and having most of my family from California, we moved back to California. And now I'm in private practice here in San Francisco.
Fantastic. Well, go Vols, right? So I'm at UTHSC in Memphis. That's a coincidence. I did not know that ahead of time.
Yeah, it was a phenomenal place to live for the duration of my residency, and I made a lot of great friends, and I got excellent training. So it was amazing experience.
All right. So back to the book. One day you woke up and you said, well, I don't have anything better to do. I really need to write this book. When was that? What was that
Well,
moment?
well, I found myself writing a lot of basically what became the chapters of this book, and I would have an issue that I wanted to convey to or explain to patients about a particular medical problem and write it in a way that made sense to them and basically conveyed everything that I wanted to tell them in a little pamphlet. And as I was writing these for patients, I thought, well, I could just keep going and write about every single thing I would ever want to tell a patient and then put it into a book. And so the book's really not meant to be read from cover to cover. And in fact, I doubt anyone will ever use it as such, but it's really meant to be browsed through and select the chapters that are of interest, or even be prescribed the chapters that are of interest, which is something that I often do for patients who come in to see me. Because as you know, we have limited time in the clinics with the patients, and sometimes that's just not enough to educate our patients. And I really think that's an important part of spine surgery, because it's a complicated field, and it's there's a lot of nuances to it. And if you go to the internet, I think you will very quickly find yourself going down the wrong channels and get misinformation or information that's not relevant to you and your problem. And so I use it as a tool. I use it as a tool to educate my patients, and that's basically how it evolved. And one day I said, well, I could just keep going and put it all together, and it became the Spine Encyclopedia.
Well, that's great. And of course, it's a tool that other orthopedic surgeons could use, right? With maybe save them
Yeah,
some time to prescribe it for their patients.
yeah, absolutely. I think that one of the problems with spine surgery is that a lot of people have back pain, and so the clinics tend to be very busy, and a lot of people need to be seen. And as the baby boomer population ages, that number will just continue to increase. And so, how do we convey information to our patients in a way that's easy to understand, that has some sort of entertainment or story value to it, which is how I like to do my writing. And then basically you get an educational nugget in one little chapter. And so I think other physicians could use it.
Well, I can't resist. I'm going to put in a historical note. About 30 years ago, I was in private practice taking care primarily of people with epilepsy, with seizure disorder. And I had literally hundreds and hundreds of them in the practice. And I found that I was saying kind of the same thing. What's an EEG? And do I have to take these medicines for the rest of my life? And what about surgery? So I started writing. In fact, I was writing for the local paper, the Ask the Doctor column. I think that's what triggered it. So I said, there probably needs to be a book on this. So I wrote a book called Epilepsy 199 Answers, which was addressing that. Now, the key here is this was before, probably can't remember that, but this was before there was no internet. So there was no FAQs where you could just type in, what is epilepsy, so that you had to like write away to the Epilepsy Foundation and they would mail you a packet. So this predated that, the easy access to information. Or, as you point out, it's very hard, I think, for the layperson to know when, even if it's not misinformation, even if it's good information, whether it actually applies to you. I think, whenever I start looking at, I got to fix some electronic gadget in my my house, and I'll go look it up, and they'll be starting in with this long story. And it's like, well, I don't know if that's really my problem or not. I don't think there's anything wrong with that information, but as you say, going down the rabbit hole, I'm not sure this is going to help me. And I think that it's really impossible. How can you possibly know? I mean, I'm a physician. I did 7 years of training. When it comes to orthopedic surgery, I know very, very little about the ins and outs of. And of course, the key is, and what your training is all about, is should I operate or not, right? And then if I'm going to operate, which operation do I do, right? I mean, and those, I mean, and you mentioned before we went online, I was talking on Kevin MD. I'm not sure if it was the episode on AI, but I've taken a very strong position that physicians will not be replaced by AI, because AI can do simple things, in many cases much better than I can, like remembering long lists of stuff and making simple algorithms. But the decision in an individual patient, whether they're going to benefit from surgery, and not die in the process, that's part of the equation. I think that equation has so many factors, like when, we studied algebra, A plus B plus C divided by, I mean, no computer is ever going to know enough to include everything that a physician, a caring, kind, and intelligent physician is going to make that calculus in their head. it's going to be centuries before AI catches up to a human being uh, in that respect, I think.
Well, I think you're absolutely correct. And I think of the spine as this very elegant and beautiful but complicated machine. And for those like you and other physicians who interact with biological systems, we know that they are very difficult to predict how they work all the time. We have ideas and we have theories about how things work. And as you gain experience in your field, as you practice medicine, I think you develop better intuition for how the machine or how the biological system works. And that's really what I've experienced as I've gone through my practice. And I tell patients when they come in to see me and they have an idea of what they think is wrong, or they come in with lots of research already having been performed, is it's very dangerous to be your own spine surgeon or even to be your own physician. Because, as you say, you can research something online, but if it's not in your area of expertise, you may only scratch the surface for what the true understandings are. And if you go online and try to figure things out, you may have an idea of what you may need, and you may get a flavor for what kind of procedures you could potentially have. But as you say, there are so many variables that go into deciding whether or not someone should have surgery and then what type of surgery they have, that I think making that decision as a layperson is impossible and probably dangerous to do. And the book does not make you an expert in spine surgery. It serves as a guide, and it serves as a way to show you basically how I'm thinking about your problem, or how another spine surgeon may be thinking about your problem. And in reality, I think you can become overwhelmed with spine surgery. It's obviously a very scary thing to have. I think it's charged with anxiety and fears and expectations that patients bring in with them. And then it's really only useful in certain situations. It's not useful for every single case of back pain. It's not going to be helpful for every single patient. And we have to decide very carefully who we're going to use it on and who we're not going to use it on, because it's obviously a dangerous thing to do to somebody, or can be risky. So I definitely consider that my main role is to help the patient navigate this complicated area with minefields all over the place, and try to help us both avoid stepping on any mines. And sometimes that's keeping people out of the operating room who don't need it. A lot of patients come in, they want a surgery to cure their problem, but a surgery, I know, is only going to lead to more and more problems for them. And so I see myself as someone who is going to protect them from going into the operating room. And as we were chatting about a little bit before, I can consider myself a reluctant spine surgeon. And I'll do it reluctantly if there's really no other options available for that patient, or I feel strongly that it is going to benefit them a lot. But it's the indications for spine surgery are very simple. And there are some things it's going to work for and some things it's not going to work for. And I think if you get wrapped up in all these gadgets and technology, and now there's robots and various things, and some people come in wanting lasers, and it's very difficult as a patient to figure out what you need and what you don't need.
All right. So if somebody has back pain and they think they need surgery and they live in the San Francisco area, how do they find you? Are you at a hospital? You have your own clinic?
Yeah,
What?
I'm in private practice. I work at several hospitals in the Bay Area, and they can find me through my website, which is just Katsuura, Katsuura, MD.com, or just Google my name and I should pop up.
Perfect. Perfect. All right. Now I want to seg a little bit to art. Um, Not everybody can illustrate their own encyclopedia. So I suspect you must have had some art interest and or training long before you decided to do the book. So I want to hear that story. When, it probably started with crayons, I would imagine. Because art is not really something you can just say like, I want to learn how to do it. There's got to be some innate talent. So where tell me that story. What happened?
Yeah, art is something that I've always been attracted to. I guess that's the right term for it, or interested in. And I do think that it's a combination of some kind of innate talent, but also from experience, from seeing other art, and from practice. Just like playing a musical instrument is something that you need to practice, but you also need to hear and have this oral capacity to do. And I think art's the same way. I think the more you're exposed to it and the more you see it and then try to do it yourself and get ideas, and I think that there's some saying out there that the best artists just steal other people's work, and I think that there's some truth to that. And, we all have inspirations and we all have things that we see, and use that to build our own creativity. And so I never really had any formal training in art. I was just something that I did, and then maybe I had some art class in elementary school, but it was something that I was just really interested in. And it's kind of ebbed and flowed through my life. There have been times where I've been very, very passionate about it, and it was really the focus of what I was doing at that age. And then there are times when I was focused on other things, like such as learning medicine. But I really started to bring it back into my life actually during medical school. So there was this whole preparatory phase for medical school that I went through where art didn't really play a very strong role. But then when I got into medical school and was learning about the human body and learning about its complexities, and I was struggling to absorb it through books. I was not good at reading books at high volume and then keeping that information in my brain. And then one day I just started to just draw the ideas out. And I thought to myself, well, this makes sense. Like I could keep information in my brain easier if I saw it in an illustrated form, and even more so if I was the one who illustrated it. And so it reignited this passion that I've had for art throughout my life. And since then, it's just kind of snowballed and become more and more applicable to the things that I'm doing. And I think if you want to learn about anatomy, for example, there's no better way than to study it through art. The famous anatomical text, Frank Netter's anatomical text, is one of my is always on my bookshelf and something that I still refer to this day. And I'm continuously in awe of his detail and just the beauty of his drawings. And that's been a strong inspiration for me and for my work.
Oh, that's fantastic, and it makes me think. The 18th century, 19th century, the British, scientists like Darwin and the guys. If you look at their stuff, they could draw. They would draw these beautiful images of things they caught at the bottom of the ocean, and they would classify things. But a lot of these scientists had amazing talents to be able to draw it. Of course, maybe it was more emphasized then because they didn't have cameras, right? If you wanted to show a picture, you had to make one, but you could see, I mean, it's artwork. Well, Audubon, for example, I mean, these aren't just rough sketches. I mean, amazingly detailed work. I mean, the guy liked birds, but he could draw, right?
Well, I think that there is just something about the human brain that absorbs illustration. That's the best way to convey information, and the best way to absorb information is to see a drawing of it. Because one of the things that we talk a lot about in surgical training is the first time you go in to do a surgery, you go through this doesn't look like the textbook, this doesn't look like
Where are the
Frank Netter drew
numbers?
it. The everything's not red and blue and yellow for neuro. It doesn't look like that in reality. And so we go through this medical training, and we say we go to Gray's Anatomy, and then the Netter's text and whatever other anatomical text we look at, and then the minute we're faced with it in reality, we're like, wait a minute, this doesn't look like the book. But the reality is that some anatomists tried to simplify things, tried to make it so we could learn about it in a more effective way. And that does serve as the very basic structure for how we learn about anatomy, and then we build on it from there. And so that was one thing for me about using art, is that I found if I drew it myself, then or if I looked, I studied it in a lab and with a cadaver, or actually even doing surgery, and then translated that into art, that I had a much better command of the anatomy afterwards, more so than if I was just studying it from a book. And I think all surgeons go through that transition where you have to learn, you understand things first in a very schematic way, and basically stick figures. Then you might have a more advanced understanding of it in 2 dimensions. So you might learn about it from a Gray's Anatomy or the Netter's text. And then you have to basically synthesize that into this 3-dimensional living, breathing, working model that you keep in your brain to be able to navigate intraoperatively. And that's something that I think art definitely plays into in helping make that transition from one stage to the next more fluid.
Yes. Well, another reminder is like why you shouldn't try this at home. It takes a lot of training and experience to be able to first see what you're doing. I know as a neurologist, I don't do surgery, but I've accompanied neurosurgeons on epilepsy surgeries, and I've looked at the brain. And sometimes they're digging around in there, and it's like, whoa, how does he, you know what he's looking at? Because there are no colors, there are no numbers, everybody's different, and things get squished. I think experience and skill and attention to detail uh, can't be overrated. So also
No.
piano, where does that fit in? I saw that on your website.
Yeah, so I'm an amateur pianist, and that for me was just another hobby that I've had for a while now, and it's my way of decompressing. And I think that there are a lot of similar skills that you develop with music and surgery, because obviously there's a motor component to it. There is a practice approach to it. So to learn a piece, you have to practice it. Just like if you need to learn a surgery, you practice it and you do different things. And so I think that there is a synergy between the two very distinct activities. But for me, it's just a way of decompressing and doing something that's totally not related to what I do on a day-to-day basis.
Now, okay. So a lot of physicians watch this podcast, and a lot of other people that have very busy jobs, and the topic of work-life balance comes up frequently. So I want your take on it as someone. I believe you're married, you got a couple kids, you got a job, you got some very demanding hobbies, and you have the same 24 hours that we all have every day. So you look pretty casual and relaxed there. So tell me about your secret to work-life balance.
Um, that's a great question, and I wish I had a good answer for you. I think that most people, most physicians just face the challenges in front of them from minute to minute, and go from one challenge to the next. And at the end of the day, they're just exhausted, and then they may face more challenges at home, and that's what ultimately leads to burnout, is this never-ending cycle of going from challenge to challenge, or from stressor to stressor. And so having hobbies, I think, is really critical to avoiding that, knowing that there's beauty outside of the hospital, that there are, life is not just pathology, life is not just suffering, which we see in the hospital, but there are these really beautiful aspects such as art and music. And for me, how I build music into my life is, as you can see, I have a piano behind. I'm in my office right now, my medical office, and I have a piano behind me. And when the door is closed, and when there's clicking on the keyboard, the music, the piano keyboard, the my assistants know not to bother me during that period, because that's a time for me to just just relax in between patients or even during lunch and just find a moment to do something, to disconnect and do something different. But I would not say that I have the answer to work-life balance.
Well, I think that was a good attempt. Thank you. All right, now before we close, anything you'd like to add?
I think in closing, I would say that the practice of medicine is really beautiful. I think that if done correctly, you develop this relationship with your patients and you learn about their medical problems, but you also interact with them from a social perspective, from a psychological perspective, and you learn about human life that way. And you learn about the spectrum of human life. And as physicians, I think we're really in a lucky position to be able to see that. But I think it can be a double-edged sword because normally when people come to see us, they're suffering or there's something wrong. And one of the joys of being an orthopedic surgeon, and one of the reasons I went into being an orthopedic surgeon, was you get to see that light at the end of the tunnel. And someone comes to see you for a problem, and you can fix it, and you take them through this journey of the anxiety of getting into the operating room, the recovery and the pain that comes from going through the surgery. But then there's this moment of a high, see that the recovery is happening, uh, and then the patients are ultimately grateful when things go well. Obviously, that's not always the case, but more often than not, it is, and that's something that's incredibly rewarding to be a part of. And I think the art of medicine, which is appropriate for your podcast title, is learning how to do that and how to hold the patient's hand throughout the entire process. I think there's so many expectations for us as physicians to be perfect, to see more patients, to have a high volume, to make more money for the hospital, but not make any mistakes. And we have a very complicated and very high demanding jobs, not just surgeons, but all physicians. And remembering that this is a human endeavor, that the patients come in, they're afraid and they have all these expectations, and learning how to draw on communication and how to interpret or translate what they're telling you into meaning clinical data, and then give them the information that they need to help make an informed choice about surgery, which is what my book was all about, is what really drives that process, and I think makes it rewarding for patient and doctor alike. So I guess my closing statement would just be that, remembering that physicians are human, and remembering also that your patients are human if you're a physician, and to try to maximize your communication, use education, and remember that this is a sacred practice that we're lucky enough to be a part of, and not get distracted by all the other stresses that we face on a day-to-day basis.
Sage words. Very well said. Dr. Yoshi Katsuura, thank you for joining me on the Art of Medicine.
Thank you so much, Dr. Wilner.
Before we close, I'd like to give another thanks to our sponsor, locumstory.com, a resource where providers can get real, unbiased answers about locum tenens. I'm Dr. Andrew Wilner. See you next time.
This program is hosted, edited, and produced by Andrew Wilner, MD, FACP, FAAN. Guests receive no financial compensation for their appearance on the Art of Medicine. Andrew Wilner, MD, is Associate Professor of Neurology at the University of Tennessee Health Science Center, Memphis, Tennessee. Views, thoughts, and opinions expressed on this program belong solely to Dr. Wilner and his guests, and not necessarily to their employers, organizations, or other group or individual. While this program intends to be informative, it is meant for entertainment purposes only. The Art of Medicine does not offer professional financial, legal, or medical advice. Dr. Wilner and his guests assume no responsibility or liability for any damages, financial or otherwise, that arise in connection with consuming this program's content. Thanks for watching. For more episodes of The Art of Medicine, please subscribe. www.andrewwilner.com.